Hey there, Dr. Mark McCawley, and today we're going to talk about what to expect when you're getting the pinhole surgical technique done. So, first things first, we'll get you in the office, we'll go ahead and we'll go through some paperwork for you, we'll get you numb, and then we can go ahead and we can do that pinhole surgical technique for you. The pinhole surgical technique, we actually end up using specialized instruments to actually free your gums up and basically make them sag down over the top of those roots, pack some collagen in between, and that way they're nice and thick and it actually covers those roots. But you just have to basically sit there, hang out with your mouth open for, depending on how long it is, between 1 and sometimes 3.5 hours or so, depending on how many teeth need to be done. But you'll be numb throughout the entire procedure and you won't feel anything besides a little tugging. After the fact, you will get some soreness and mostly swelling with the procedure right here. So it's a closed procedure, so you do get more swelling than with some other procedures, but you get less pain, so that's a good thing as well. So with that procedure, typically the swelling comes up for about 3 days, peaks, and then comes down for about 3 days. So figure being swollen for about a week or so. The first 3 days are the most dramatic, but after that it gets much better and better every single day. So that's basically what to expect with the pinhole surgical technique. So thank you very much.